Okay, so we're going to talk about old dog issues, and before I start talking about these old guys and sort of the things that they'll experience as they age, I want you to keep in mind the right half of this chart under canine. Remember, all these different dogs that you're going to meet, whether they're Chihuahuas or Australian cattle dogs or Border Collies or Shepherds or Irish Wolfhounds or Tibetan Mastiffs or anything, they're going to experience these changes at different times in their lives. There's no hard and fast that, oh, they hit 9 years old, they're senior, all this is going to start happening. You will see some tendencies more than others, maybe across breeds, maybe across age, possibly in overall size. But keep in mind, the larger the dog, the faster they age. So if somebody comes to you and says, hey, well, you know, my little miniature poodle or my Shih Tzu is 9 years old, they could just be getting started. But if they come to you and say, oh, you know, my husky is 12 years old, ooh, wow, that's impressive, good job. So it's things like that. So as dogs age, they can have a plethora of problems. And these will manifest differently. I've got cognitive issues there at the top, and it's the hardest one to diagnose because a lot of times what people think of, oh, he's just getting old, or oh, she's just senile, they actually have a reason. I want you to remember, dogs don't know what age is. They have no idea that they're old. They have no idea what senior is. Geriatric, they've never heard of it. All they know is that, hey, I'm more stiff. I can't see as well as I used to. Wow, I'm really thirsty. I gotta drink a lot. Now I gotta go outside and pee. So they just respond to the cues and what their body's telling them. And what we see outwardly isn't necessarily spite or senility or anything. It could have a medical issue. So even though I've got cognitive issues there at the top, it's entirely possible that what clients perceive as a cognitive issue or dementia or senility in their old dog is actually a medical problem that might be more easily dealt with. Because trust me, dementia in dogs is hard to deal with. So I'm going to skip that one a little bit for now. And one of the first things we'll notice is reduced mobility. These guys will get stiff, they'll get sore, and usually what you see is what they're not doing. So they're not bounding up the stairs with you. They're not, racing out the door to go on their walks. They're like, yeah, okay, let's go. Maybe they're going out on their walks, but instead of walking 4 blocks, after, 2 or 3, they're just, done, and they stop, they sit, they lay down, they don't want to go any further. And that could be them saying, you know what, this hurts, I don't want to do this anymore, I'm done. If you've got a 90-pound golden retriever, you now have a problem if you're 2 blocks away from home. But that's what you see. Years ago there was an ad for Betacam, and it showed a family at the top of the stairs all interacting, having dinner, and the dog at the bottom of the stairs, just laying there quietly. And they said, this is what arthritic pain looks like. And that's what it is. Dogs don't know what causes it. All they know is that it hurts when I go upstairs. It's not comfortable for me to lay on the floor anymore. I want to be on the bed. But it's hard for me to get up on the bed. So they will lay in odd spots. They'll shift position frequently. They won't go up the stairs or down the stairs the way they used to. They just won't do things that cause them pain. So in that respect, they're kind of smart. Dental disease. Most dogs have dental disease because most clients don't brush their dog's teeth. So what you'll see is them either dropping food, making a mess outside the bowl where they normally wouldn't. Dogs, good luck with them not eating. They will always eat. People will say, oh, how can he have, such bad dental disease? He hasn't stopped eating. Well, yeah, it's eat or die, and when have you not noticed a dog that wants to eat? So they'll drop food, they'll swallow it whole, they won't chew it. Maybe they'll refuse to play with their favorite toys if it hurts their teeth. You never know. So watch for those types of things. There was a statistic I saw that 86% of dogs over the age of, I think, 5 or 6 years old have some form of dental disease, whether it's mild or horrible. You guys have already been through the dental module over on the lab side, and I know you covered it a bit in domestic animal science, so you know what's important, and it can affect a lot of different body systems. So addressing dentistry, especially in small breed dogs, they tend to be more prone to it. So make sure that you mention that to clients if you see that they're having issues. Decreased organ function is really vague. But in this case, I'm usually talking about things like the liver, the kidneys, sometimes the thyroid, but that's more with the cats. But the decreased organ function usually manifests with changes in urination or drinking, which means they'll drink more and therefore they'll pee more. And the problem with that is, if they're drinking more, they've got to pee more. If they're not allowed outside as frequently as they need, they may start swelling in the house. So people then think they become incontinent. Maybe they're not incontinent. Then people start thinking, oh, well, he's old, he's senile, what am I going to do? That goes back to those cognitive issues. Maybe it's not a cognitive issue. Maybe he's just drinking more because he's got a kidney or a liver problem or something else going on. Maybe it's something simple like a bladder infection, and he's just not getting let out enough. So if you ask owners and they say that, he's drinking more, or he started peeing in the house, maybe we should talk to the vet about doing some blood work. It's not something you can recommend, but you can sort of plant that seed and tell them to ask the vet about it. As far as vision and hearing impairment goes, just like us, they start losing their hearing. So they don't get selective, they don't get lazy, they just don't hear us. And same with the vision. So these will manifest differently. What you'll see with a dog with hearing loss, sometimes they will start barking into space. They think they hear something, or they think they see a shadow if they're losing their vision and they start barking at it. If they are being called, they may not respond to their name. If you open up the bag of food and they don't come running, maybe you think their appetite's off or they're not feeling well, they just didn't hear the bag. If you've been home for an hour and they suddenly start barking like, hey, you're home, I'm so glad you're home, they're not senile because they, don't recognize you. It's that they didn't hear you come in and drop your stuff like you normally do. So these are the ones that quite often get mistaken for cognitive issues. And with vision, they will, people always think of them bumping into things, but vision isn't like a switch. It fades over time. And you see those old dogs with those blue eyes sort of show up, that bluing in the eye. The eye itself doesn't go blue, but it's the lens inside the eye that hardens, and it gets like a blue-gray sort of filter to it, and they're getting cataracts, basically. So if you've got stairs, it's hard for them to judge maybe the distance that those stairs are or how deep they are. So what they'll do is they will go up against a wall, they'll be reluctant to go down the stairs, and they'll be really hesitant because they can't see where their foot is going. So they're really, really nervous about going downstairs. And that could be mobility, but quite often if it's going downstairs, it's often vision, so watch for that. Okay, obesity. Obesity is not just an old dog issue. I see plenty of young dogs that are overweight. But as far as obesity goes, again, as these guys get older, maybe they get stiff and sore. And if they get stiff and sore, they're going to gain weight. So a lot of the senior diets may be, for dogs, lower in calories to avoid that obesity. Because as they get more overweight, you're going to end up with heart problems and joint problems, and it'll aggravate that arthritis that maybe is going on with that reduced mobility that they've got. So sometimes they've got multiple things going on. And obesity is one of them, and sometimes it's their lifelong and it just starts aggravating things as they get older. Cancer. Cancer's hard because you can have little benign lumps all over and they're all nothing, and then you can get one big nasty lump or one small nasty lump that ends up being a big deal. So whenever you've got growths that you see outwardly on a dog, watch for sudden changes. If it's growing quickly, if it starts oozing, if it's changing color, if he's bothering with it, if it's interfering with the movement of his legs or his comfort, his ability to move himself around, that's something to hop on top of. So if you ever see any growths and you're worried about them, always ask the vet about it. Or if you notice something, bring it to the attention of your vet or your tech that you're working with. Incontinence, already kind of touched on that with the decreased organ function. Incontinence usually doesn't happen on its own. It's either there, especially with females after they're spayed, that can be a risk because there's no estrogen hormone there. But incontinence as they get older is usually related to something. If they're house soiling and peeing around the house, then there's something going on medically. And that's where blood testing and urine testing come in. So that's something that the doctor's going to mention. But if an owner mentions to you that a dog is suddenly peeing in the house where he didn't before, that's something to bring up to the vet and mention so the vet can address it. Heart disease is tough. It takes years to manifest. Usually they have to have a heart problem for about 3 to 5 years before you start seeing things like cough and fatigue. And what you'll see is that they've got a reduced energy level. So back to those walks, that dog will, he'll get tired faster. So maybe after he sits or lays down after 2 blocks instead of 4, but he runs up the stairs when he gets home, maybe his mobility's okay, but maybe he's just getting tired and he's not able to keep up that level of activity as long as he used to. So watch for that. Older dogs are prone to heart disease. And again, it's usually they're tired, they cough, but not always. Sometimes it's really subtle. And dogs are usually, no, I'm fine, let's just play, I love you. So they'll gloss over things. And owners may not pick up on subtle clues. On the flip side of that, some owners are really in tune with their dogs. So if they mention little things that maybe are different from what they were a few months prior or back when they were younger, flag it. Make sure you mention it to the vet and say, you know what? She mentioned he started doing this, or he's stopped playing with his favorite toy, or he's not going on as far on his walks as he used to. And that just started 3 months ago, 6 months ago, a year ago, and she's mentioning it. And that'll be something that the vet can follow up or the tech can talk to them about. But if you hear something like that, flag it. These old guys, they are just more than happy to be with us a lot of times. And they will really do the no, I'm fine. So all of these things that we see, sometimes they get compounded and people just think, oh, they're just old dogs. He's getting old. What can I do? Obesity, easily fixed. Dental disease, easily treated. Reduced mobility, we got supplements, we got foods, we got pain medication. We can keep these guys comfortable. Decreased organ function, we have specialized diets. We have blood testing to keep on top of it. We have supplements to help with organ function and support them. Heart disease, same idea. We can't necessarily turn back the clock on organ function or heart disease, but we can do things to help make it better. We can give them medication to help the heart pump the way it should and keep their blood pressure down. If they're incontinent, maybe we can just figure out what's going on. Cancer, sometimes when you take the lump off, that's all that needs to be done. Other times there's other things to do. If we don't test, if we don't investigate, we can't treat. And if we can't treat because we don't know what's going on, then this dog could be uncomfortable and it could be sick for a long time and maybe even shorten its life. So our main goal here is keeping them comfortable. So on the next video, I'm going to talk about cats. I have a real soft spot for old cats. That's why I have 2 old cats. And their issues overlap with old dogs, but sometimes they're a little different. They've got some really unique things because, hey, they're cats. So go on to the next video, number 3, and we'll get into some of the issues that cats deal with that are a little bit unique to them.